Hello friends, started today I'll discuss about the IoT use cases. Okay, I have already discussed some IoT impacts in a few last lectures. So today I'll discuss about the some use cases of IoT. So if we start with the use cases, so first we have to I want to tell what is the use cases in healthcare application. Okay. Okay, what is the use case in healthcare application? Right. So normally, the how IoT helps lots of thing in case of the healthcare application. How it can be helped. Okay, so that we'll discuss now, right? And you can based on these use cases, you can build different kind of the IoT device which can be helped for healthcare applications. Okay, so in case of the healthcare, you can divide devices into three parts. For IoT, for patient, for doctor, and for hospital. Okay, three things you can IoT for patient, for doctor, and for hospital. Okay, right now, so for IoT for patient, how it can help for a patient? Okay, so normally, if you want to suppose a patient, okay, so we know that we are having lots of difficulties, and we will have the lots of health problem. Okay, first you think headache problem, heart rate. You can measure the what is my heart rate, and blood pressure, sugar level, and how many calorie I have burned today. So this thing, based on this thing, so if there is any ups and down, you can. You will have some kind of the disease, and you cannot predict. So after some time, if you go to the hospital and if you take appointment from the doctor, that time you can realize that you will have some disease. Okay, right. So before rush in the hospital, or before going to the hospital emergency purpose, you can understand in prior what is your problem. Okay, so IoT for patient, that means if you can there will be lots of devices. You can design a IoT device like this way, which can sense your all the health parameters, or which can sense some few health parameters which are dangerous for your health. Okay, some common disease, stroke is the one of the more, and the diabetes. Okay, these two things are most common diseases in our daily life now. Okay, so you can put those kind of the sensor on your body, right? So you can measure your calorie. Okay, what kind of thing you can calorie? Okay, blood pressure. Okay, or glucose level. These three things you can measure, right? So after that, so you can daily purpose, you can measure a calorie, and how exercise, what kind of the exercise you want to do for burning the calorie, right? This thing you can measure by using some kind of the IoT devices. Okay, so how it is helped, so you can understand if anything is the ups and downs is there, you can go to the hospital, you can book appointment in private. Okay, so this is the IoT for patient. Now IoT for doctor. Now come to the IoT for doctor. For doctor. Okay. So how the IoT helps for doctor? Okay, so normally suppose if you don't know what is your problem, right? What is your disease and what is the symptom mainly, but you are not feeling well, so you want to want to go to the hospital. Okay, so after that you took an appointment and you visited the hospital. Okay, and the doctor did not doctor also did not know about what was your problem, right? So doctor used to put a one IoT device on your body. Okay, after some time so you can come to home, and after some time the doctor can the whatever information, so whatever suppose you have some kind of the problem, but doctor does not know what is the main problem, what kind of the precaution, what kind of the treatment they can give. Okay, so that's why they used to provide a IoT device on your body. So the IoT device will track your suppose any kind of the thing, blood pressure or a glucose level, right? And says the sensor will send those information parallelly to the doctor, and the doctor can visualize those data, and immediately if the better treatment is required and better medication is required, the doctor immediately will help you regarding. Suppose doctor is given some medication, okay, but this is not accurate. So by using the IoT data, the suppose today this is the your body parameter of health parameter, but tomorrow it can change. Okay, so if it is changed, the change data can be tracked by the doctor, and they can change the medication or they can give the better treatment. Right, so that's this IoT can help doctor. Okay, next is the IoT, how it can help for the hospital. Okay, so for tracking different kinds of the thing, suppose oxygen pump. Okay, different kind of the cylinder. Okay, and lots of things you can see from the instrument. Okay, hospital instrument. This kind of the location of those things can be detected by the devices. Okay, immediately suppose one oxygen pump or oxygen cylinder is required. So whether it is available in a hospital or not, in a go down or in storeroom, the IoT device can be detected, and it can be management can see those available data, and if it is not present, then they can order infrared. Okay, so and another thing is that suppose different kind of the staffs has been deployed by the management committee in hospital in different location. Okay, whether they are performing, okay, deployment of this staff, whether they are performing, they are working properly or not, different kind of the kinds of the stuff they are perform properly or not. This thing also can be detected by the IoT devices, and this data will be sent to the management committee. Now come to the what kind of the monitoring system you can design for healthcare. Okay, for this thing. Okay, for patient. I told that the IoT can help for patient and for doctor and for hospital, but you have to design the different kind of the instrument for that. Okay, so suppose first of all I want to tell, so instrument which can be designed for remote patient monitoring. Okay, so first is the remote patient monitoring. Okay, so same thing, you can design a device or sensor, okay, for patient, for remote patient. Okay, you can design. Okay, so the data will be detected, different kind of the data, right? Heart rate, pressure. Okay, this thing can be detected, and this data will be transferred to the software, which can be viewed by the patient as well as the doctor. Okay, this will be transferred to the software. Okay, this through the information will be transferred to the software, which can be analyzed. which can be analyzed by doctor or patient. Patient cannot do anything; they can only analyze or they can only view, but doctor can analyze those data. If any ups and down is there in this data, the doctor can take a better take a precaution. Okay, take a better treatment plan. Okay, and suggested treatment they can give to the particular patient. Okay, because the patient is they are in the remote location. Okay, they cannot immediately come, but doctor, by analyzing those data, doctor can suggest a proper treatment. Okay, how what kind of the medication they need to require. So accordingly they can buy through online or through video calling, they can give the suggestion to patient. Okay, so that is first design. First of all, you have to design a device which can be placed in a remote location. So for that, the communication is also important. The range of communication. So the device you have placed in a remote location, which will transfer all the data to the doctor. Okay, so you have to design a device which can be used for the remote patient. Okay, next is the implanted glucose level monitoring. Okay, that means in the human skin. Okay, human. Under the skin, you can put a sensor which detect glucose level. Okay, the human skin. So the doctor can implant one kind of the sensor under the human skin which can detect the glucose level. Okay, this glucose level, the amount of the glucose level that will be transferred. This level, the information that will be transferred to the mobile. Okay, that will be transferred to mobile or any kind of the app. Okay, for patient. This is patient mobile. Okay, so the sensor that will be detected the glucose level from the human skin, and that will be transferred to the mobile. Okay, of the patient. Okay, right. So if glucose level is normal, that is fine. If there is any risk or if there is any low level of glucose, very low level of the glucose or high level of the glucose, that thing can, this kind of the information will be sent into mobile in the form of the alert or notification. Okay, so accordingly the person or patient can take precaution, or they can go to the hospital for checking the glucose level, whether it is normal or they have to take any precaution or medication or not. Okay, so that is the implemented glucose level monitoring. Next is the heart rate monitoring. Next is the heart rate monitoring. Okay, in case of the heart rate monitoring, so wearable device like fitness band. Wearable device like fitness band, they can put a wearable device like fitness band or some kind of the sensor that will be printed on the t-shirt on the textile. Okay, so this kind of the sensor will be printed on the textile. Okay, which can detect the heart rate. Okay, which can detect the heart rate or textile sensor on cloth. Detect the heart rate or pressure. Both can detect the heart rate or pressure, right? So what kind of the device? Fitness band you can use, or you can also use such kind of the cloth where the different sensor will be placed, which can detect the heart rate or blood pressure. Okay, in this you can measure, and those heart rate data will be transferred to the transferred to the doctor. Okay, those are heart rate data transferred to the doctor. Okay, and if there is a chance of any stroke, or there is a chance of the mild stroke and high blood pressure, then the ambulance can be dispatched from the hospital in private. Okay, so for that, so this thing can be observed by the doctor. Okay, so this thing can be observed by the doctor. If any chance of the high blood pressure or the mild stroke, then this ambulance can be sent from the hospital in private. Okay, so this next, this one is the heart rate monitoring system. Okay, so in the upcoming lecture I will discuss what are the research are going on related to this thing. This I will discuss. Okay, next is the hand sanitize monitoring. So hand sanitizer monitoring, in this case also, suppose lots of patients or lots of persons are entering and leaving from the hospital during COVID time. So it is difficult to understand whether all the persons or all the patients they are sanitizing, they are washing their hand, or they are sanitizing their hand properly or not. Okay, so which can be through which the different kind of the virus can be spread from one patient to another patient, right? So we can design a sensor which can detect whether the persons can whether the person sanitize their hand or not properly or not. Okay, so you can this is one of the most recent application, the hand sanitize monitoring sensor. So this sensor will be placed normally in the front door of the hospital when the persons enter, so they can detect the what are the things are there on our hand. Okay, so this thing can be detected by the sensor, biochemical sensor will be there. So this thing can be detected by the sensor. If any virus or anything is there, so that means the persons did not wash their hand or did not sanitize their hand properly. Okay, so this information, and that the information will be sent in the person in mobile phone only. So you have not washed your hand or you have not sanitized your hand. Okay, in the form of the alert message or notification. Okay, the notification message also can hear the other persons or other hospital committee also, right? So this is the one of the important monitoring system, that is the hand sanitize monitoring. So it will not be so through which the different kind of the disease may spread, right? So lots of components, lots of monitoring systems are also available, so I'll discuss in the upcoming lecture. So thank you. Please like, share and subscribe my channel.